Imagine walking into a routine checkup feeling completely fine, only to discover that the very pill you take daily for aches and pains is quietly structuralizing a heart attack. Every single day, millions of older adults open their medicine cabinets and swallow a tiny capsule that they assume is perfectly safe. But today, a prominent cardiac surgeon is sounding an urgent alarm that you cannot afford to ignore. There is one incredibly common, widely used class of drugs that is actively damaging the hearts of older adults, spiking blood pressure, forcing the body to retain dangerous amounts of fluid, and silently doubling the risk of heart failure. If you or someone you love is over the age of 60, you need to stop what you are doing and pay close attention, because this specific medication might be sitting in your cabinet right now, masquerading as a harmless remedy. Welcome back to the channel, where we break down the latest, most critical health updates to keep you and your loved ones safe. Today, we are diving deep into a massive, urgent warning issued by leading cardiologists and cardiac surgeons regarding a class of medications that almost every older adult has taken at some point. As our bodies age, the way we process medications changes drastically, turning once helpful pills into potential toxins. In this video, we are going to uncover exactly what this drug is, the precise mechanisms of how it wrecks your cardiovascular system, the hidden signs of heart damage you must look out for, and the safe, doctor-approved alternatives you can switch to immediately. Your heart health is your life, so make sure to stick around until the very end so you can protect yourself and your family from this silent threat. To understand why this warning is sending shockwaves through the medical community, we first have to talk about what happens to the human cardiovascular system as we cross the threshold of 60. Aging naturally changes our blood vessels, making them stiffer and less resilient. Our kidneys, which act as the body's ultimate filtration system, slowly become less efficient at clearing medications from our bloodstream. This creates a perfect storm where drugs linger in the body much longer than they would in a younger person, amplifying their side effects. Cardiac surgeons see the direct consequences of this every day on the operating table, observing hearts that are overworked, strained, and structurally weakened by chronic medication toxicity. When a leading surgeon steps up to warn the public about a specific pill, it means the clinical data is overwhelming and the danger is immediate. The primary medication class triggering this massive warning is none other than nonsteroidal anti-inflammatory drugs, commonly known as NSAIDs. This category includes incredibly popular over-the-counter pain relievers like ibuprofen and naproxen, as well as powerful prescription strength doses like diclofenac, meloxicam, and celecoxib. For decades, older adults have relied on these pills to cope with the everyday realities of osteoarthritis, chronic back pain, and joint stiffness. They are sold in massive bottles at every pharmacy, grocery store, and gas station, which gives the public a false sense of absolute safety. Because you do not need a prescription for basic ibuprofen, people assume it is as harmless as a vitamin, but cardiac surgeons warn that for an aging heart, regular NSAID use can be absolutely catastrophic. Let us look at exactly how these medications cause direct, severe damage to your heart muscle and circulatory system. When you take an NSAID, it works by blocking specific enzymes in your body called COX enzymes, which are responsible for producing the chemicals that cause inflammation and pain. However, these same enzymes play a vital role in maintaining the health of your blood vessels and regulating your kidneys. By shutting them down, NSAIDs cause your blood vessels to constrict and narrow, which immediately forces your heart to pump much harder to move blood throughout your body. This restriction causes a rapid and sustained spike in blood pressure, which is a leading trigger for strokes and sudden cardiac events in older adults. The damage does not stop at high blood pressure, as NSAIDs have a devastating impact on renal function, causing the kidneys to hold on to excessive amounts of sodium and water. For a young, healthy individual, a little extra fluid retention might just cause minor bloating, but for an older adult, this excess fluid enters the bloodstream, massively increasing the total volume of blood that the heart has to circulate. This sudden overload stretches and strains the heart muscle, rapidly accelerating the onset of congestive heart failure. If an individual already has a mild, undiagnosed weakness in their heart, the fluid retention caused by regular ibuprofen use can easily push them into an acute cardiovascular crisis, landing them straight in the emergency room. Furthermore, medical research has conclusively shown that NSAIDs disrupt the delicate chemical balance that controls how your blood clots. They increase the likelihood of dangerous blood clots forming inside your coronary arteries, which can instantly cut off blood flow to the heart muscle and trigger a massive heart attack. The Food and Drug Administration took the danger so seriously that they strengthened official black box warnings on these drugs, explicitly stating that NSAIDs can increase the risk of a fatal heart attack or stroke within the very first few weeks of use. The risk skyrockets the longer you take them and the higher the dosage, making chronic daily use for arthritis an incredibly dangerous gamble for anyone over 60. What makes this situation even more hazardous for older adults is the phenomenon known as polypharmacy, which simply means taking multiple different medications at the same time. The vast majority of seniors are already prescribed medications to manage existing health conditions, such as blood thinners like aspirin or warfarin, or blood pressure medications like ACE inhibitors and diuretics. When you introduce an over-the-counter NSAID into this mix, a highly toxic chemical interaction occurs. NSAIDs completely neutralize the effectiveness of standard blood pressure medications and diuretics, leaving your hypertension entirely unmanaged. At the same time, combining an NSAID with a prescription blood thinner drastically multiplies your risk of internal bleeding, particularly in the stomach and brain. Cardiac surgeons are deeply concerned because the symptoms of NSAID-induced heart strain are frequently misdiagnosed or completely ignored by patients. The early warning signs are often subtle and easily blamed on old age or general fatigue. For instance, if you notice sudden swelling in your feet, ankles, or legs, this is not just a sign of walking too much. It is a classic indicator that your heart is struggling to pump the excess fluid caused by your pain medication. Similarly, experiencing sudden shortness of breath while performing basic household tasks or waking up in the middle of the night gasping for air means that fluid is beginning to back up into your lungs due to medication-induced heart strain. Other silent signs include an unexplained, rapid increase in your body weight over the course of just a couple of days, which is almost always a result of dangerous fluid retention rather than fat gain. You might also experience bouts of dizziness, uncharacteristic fatigue, or a fluttering, irregular heartbeat, which are direct signals that your cardiovascular system is operating under extreme duress. If you are taking regular pain medication and notice any of these symptoms developing, it is absolutely critical that you do not ignore them. These are the exact red flags that precede a major cardiac event, and recognizing them early can quite literally save your life. The good news is that you do not have to live in agonizing pain to protect your heart, as there are many safe, highly effective alternatives available that do not pose a threat to your cardiovascular system. For mild to moderate pain relief, acetaminophen is generally considered a much safer choice for the heart, provided it is taken within the recommended daily limits and your liver function is healthy. For localized joint pain and arthritis, topical pain relief gels containing diclofenac are a fantastic option because they deliver the anti-inflammatory medication directly to the painful joint, allowing only a microscopic amount to enter your bloodstream, thereby sparing your heart from damage. In addition to safe medication switches, embracing natural anti-inflammatory strategies can drastically reduce your reliance on pain pills altogether. Incorporating high-quality omega-3 fatty acid supplements, turmeric and ginger into your daily routine can help naturally cool down systemic inflammation without harming your blood vessels. Physical therapy, low-impact exercise like swimming or cycling, and targeted acupuncture have also been scientifically proven to rebuild joint strength and alleviate chronic pain safely. Managing pain in older age requires a holistic approach that looks at the whole body, rather than just reaching for the fastest chemical fix in the medicine cabinet. If you or a loved one are currently taking daily NSAIDs for pain management, the absolute most important step you can take right now is to schedule an honest, comprehensive medication review with your primary care physician. Do not abruptly stop taking any prescribed medication cold turkey without professional guidance, as this can cause rebound inflammation and severe pain spikes. Instead, sit down with your doctor, lay every single bottle and supplement you take on the table, and ask them directly if your pain management plan is safe for your heart. Empower yourself with knowledge, track your daily blood pressure, and always read the active ingredients on over-the-counter bottles to ensure you aren't taking hidden NSAIDs. Your health is your absolute greatest asset, and staying informed is the single best way to protect it. If this video opened your eyes to the hidden dangers lurking in your medicine cabinet, please take a moment to hit that like button and share this crucial information with your parents, grandparents, and friends who need to hear it. Don't forget to subscribe to the channel and turn on the notification bell so you never miss our life-saving health breakdowns. We want to hear from you, so drop a comment down below letting us know what pain remedies you use, or if you have ever noticed side effects from these medications. Understanding the history of these medications is essential to grasping why they are so deeply embedded in our culture and our medicine cabinets. Decades ago, when NSAIDs were first introduced to the general public, they were hailed as a miraculous breakthrough for arthritis and chronic pain. For the first time, people who had been sidelined by debilitating joint stiffness could suddenly move, walk, and participate in life again. It was a revolutionary moment in medicine, and that early success created a lasting legacy of trust. However, the medical understanding of how these drugs interact with the aging heart was, at that time, in its infancy. We have spent the last 30 years observing, documenting, and analyzing the long-term outcomes of patients who utilized these drugs for years, and the data has gradually painted a much darker picture than we initially realized. This is not to say that the intent of the medication was malicious, but rather that we are now witnessing the cumulative, multi-decade effects of a class of drugs that was never truly designed for the physiological realities of a human heart that has been beating for 7 or 8 decades. As we dive deeper into the science of why these drugs pose such a threat to the aging cardiovascular system, we must look at the concept of physiological reserve. When you are 20 or 30 years old, your body possesses an immense amount of reserve capacity. Your kidneys can handle a surge of toxins, your heart can pump against higher resistance without faltering, and your blood vessels can constrict and dilate with incredible speed to adapt to changing conditions. You are essentially operating with a high-performance engine that has plenty of backup power. But as we age, that reserve capacity naturally begins to shrink. This is a normal, unavoidable part of the human experience. The problem arises when we treat our bodies as if we still have that youthful reserve. When you add the burden of chronic NSAID use to an aging system, you are essentially asking an engine that is already running on low fuel to suddenly pull a massive trailer up a steep mountain. The system, eventually, has to give way. The mechanism of this breakdown often starts in the kidneys. The kidneys are not just waste filters. They are the master controllers of your blood pressure and fluid balance. They constantly monitor the blood flow entering their filters and adjust hormones accordingly to ensure that your blood pressure stays within a safe, narrow range. NSAIDs act like a wrench thrown into the gears of this delicate monitoring system. They inhibit prostaglandins, which are signaling molecules that tell the kidneys to maintain good blood flow. Without these signals, the kidneys panic. They perceive that there is not enough blood flowing through them, so they react by triggering a complex hormonal cascade designed to raise your blood pressure and force your body to retain salt and water to increase the blood volume. This is a survival mechanism intended to save you from dehydration or blood loss, but when you take an NSAID, you are tricking your body into believing it is in a state of emergency when it is not. The result is chronic, systemic high blood pressure and fluid overload that puts massive, unnecessary stress on your heart muscle every single second of the day. This leads us to the concept of myocardial remodeling. When the heart is constantly forced to pump against increased pressure, a condition known as afterload, the muscle cells themselves begin to change. They can thicken, becoming stiff, and less capable of filling with blood properly. This condition, often referred to as left ventricular hypertrophy or heart failure with preserved ejection fraction, is a silent killer because in the early stages, you might not feel like you are having a heart attack. You might just feel slightly more tired, or you might find that you cannot walk up the same flight of stairs you could manage last year. You assume it is just aging, but in reality, your heart is literally thickening and straining to overcome the pressure created by your daily medication. This structural change is dangerous because it makes the heart much more susceptible to arrhythmias, such as atrial fibrillation, where the heart's electrical system loses its rhythm, creating a terrifying, racing, or fluttering sensation in your chest. It is also critical to understand the interaction between NSAIDs and the clotting cascade. The body has a very sophisticated system for forming clots to heal wounds and dissolve them when they are no longer needed. NSAIDs disrupt this balance by reducing the ability of platelets to aggregate. While this might sound like it would prevent clots, in the context of a heart that is already strained, it often leads to a chaotic and unpredictable blood environment. Furthermore, the inflammation-reducing properties of these drugs can paradoxically mask the body's natural inflammatory response to damage, meaning that if you do experience a minor cardiovascular event, your body might not be able to mount the appropriate protective response. This is why the FDA warnings are so specific about the increased risk of heart attack and stroke. It is not just about blood pressure. It is about the fundamental chemical chaos that these drugs induce within the vascular system. Now, let us address the psychological burden of pain. Chronic pain is exhausting. It drains your mental energy, interferes with your sleep, strains your relationships, and can even lead to depression. When you are in constant pain, you are willing to try anything to find relief. This is why it is so difficult for patients to stop taking NSAIDs. They fear the return of the pain more than they fear the potential unseen damage to their heart. However, this is a false dichotomy. You do not have to choose between heart health and pain management. The medical community has advanced significantly in the last few years, and we now have a much broader arsenal of tools to manage chronic pain that do not involve systemic heart-damaging medications. The key is to shift from a pill-centric mindset to a comprehensive multimodal pain management strategy. One of the most effective yet underutilized tools is physical medicine and rehabilitation. Often, the pain we feel in our joints and muscles is a result of compensatory mechanics, meaning because one part of your body is weak or misaligned, other parts are working overtime to compensate. For example, if you have weak gluteal muscles or a stiff lower back, your knees will take on all the impact of every step you take, leading to chronic knee pain. If you simply take an ibuprofen to hide the pain, you are not fixing the underlying mechanical issue. In fact, you are likely making it worse because the pain medication allows you to continue moving in a way that is causing further damage. Working with a physical therapist can help you identify these mechanical imbalances. A good therapist will teach you how to strengthen the muscles that support your joints, improve your range of motion, and change the way you move so that you are no longer stressing the painful areas. This is not a quick fix, and it requires effort, but it is the only way to achieve long-term, sustainable pain relief that actually heals the body rather than masking the symptoms. Dietary intervention is another massive, underutilized pillar of pain management. We live in a society that loves the fast result, but nutrition is the slow, steady foundation of your health. Chronic inflammation is the root cause of most joint and muscle pain in older adults, and your diet is either fueling that fire or putting it out. A pro-inflammatory diet, high in processed sugars, refined carbohydrates, and unstable vegetable oils, is likely contributing to your pain levels. By shifting toward an anti-inflammatory diet, you can often achieve a level of pain reduction that surprises patients. This means increasing your intake of omega-3 fatty acids, which are found in fatty fish like salmon, sardines, and mackerel, or high-quality fish oil supplements. Omega-3s work by actively down-regulating the inflammatory pathways in your body, providing a natural, safe way to reduce pain without the side effects of drugs. Additionally, consider the role of polyphenols and antioxidants in your daily intake. Foods like berries, leafy greens, nuts, seeds, and turmeric are packed with compounds that protect your cells from oxidative stress. Turmeric specifically contains curcumin, which has been studied extensively for its ability to mimic the pain-relieving effects of NSAIDs without the negative impact on the kidneys or heart. When used in conjunction with black pepper to improve absorption, turmeric can be a game-changer for many people suffering from inflammatory joint pain. These are not magic potions, and they won't work overnight, but over the course of weeks and months, they change the internal environment of your body, making it much less hostile and much less prone to chronic inflammation. Let us also talk about the importance of sleep and stress management in the context of pain. When you are sleep-deprived, your body's pain threshold drops significantly. You feel pain more acutely, and your emotional tolerance for that pain decreases. Furthermore, stress triggers the release of cortisol, a hormone that, when elevated chronically, causes muscle tension, disrupts healing, and increases inflammation. Many older adults find that their pain is significantly worse on days when they are stressed or have slept poorly. Addressing these lifestyle factors, improving your sleep hygiene, practicing mindfulness or meditation, and finding healthy outlets for stress can have a profound impact on your physical comfort. It sounds simple, perhaps even simplistic, but For many patients, managing the stress and getting proper restorative sleep is the final piece of the puzzle that allows them to finally reduce their dependence on pain medication. If you are currently taking NSAIDs, it is crucial that you have a structured plan to taper off them under medical supervision. Do not just stop cold turkey, especially if you have been taking them for a long time. Your doctor can help you create a schedule to slowly reduce the dose, which minimizes withdrawal discomfort and allows your body to adjust. During this transition, be prepared for a temporary increase in discomfort. This is the time to lean into the non-pharmacological therapies we discussed. Start the physical therapy, increase your omega-3 intake, and focus on gentle movement. If the pain becomes unmanageable, there are other, safer prescription options that do not carry the same cardiovascular risks as NSAIDs. There are nerve pain medications, topical analgesics, and even certain types of injections that can provide relief without stressing your heart. Your goal is to find the lowest possible dose of the safest possible medication, or better yet, to find the combination of lifestyle changes that eliminates the need for the medication entirely. Empowerment is the antidote to fear. When you understand how these medications work, why they are dangerous, and what alternatives exist, you are no longer a victim of a system that prescribes pills without explaining the risks. You are a partner in your own healthcare. You have the right to ask your doctor, "Is this medication safe for my heart?" Or, "What are the cardiovascular risks of this drug?" If your doctor dismisses your concerns or is not willing to discuss alternatives, find a new provider. You deserve a healthcare team that treats you as a whole person, not just a list of symptoms. Bring a list of all your medications to every appointment, including every over-the-counter pill, vitamin, and herbal supplement. Interactions are extremely common, and your physician needs to have the full picture to keep you safe. We also have to acknowledge the role of technology in managing our health. Today, we have access to wearable devices that can monitor our blood pressure, our heart rate, and even our activity levels. Using a home blood pressure monitor is perhaps one of the most important things you can do. By tracking your blood pressure daily and keeping a log, you provide your doctor with crucial data. If you start taking a medication and notice your blood pressure trending upward over the next 2 weeks, you have the evidence right there to show your physician. This data-driven approach takes the guesswork out of the equation and allows you to catch potential problems before they escalate into something dangerous. It is also worth noting that the pharmaceutical industry often markets new drugs or combinations with heavy advertising, which can create a sense of urgency or necessity that isn't always grounded in clinical reality. Be skeptical of the flashy advertisements you see on television. Just because a drug is new and heavily marketed does not mean it is safer or more effective than traditional methods. In fact, sometimes new drugs carry risks that we are only just beginning to understand. Always prioritize clinical evidence and the advice of a healthcare provider who understands your specific medical history over a commercial that plays during your favorite show. As we look toward the future, the medical community is making strides in regenerative medicine. Procedures like platelet-rich plasma, PRP therapy, and other biologic treatments are showing great promise in healing joints rather than just suppressing pain. While these treatments are not yet available for everyone and can be expensive, they represent the future of orthopedic care, a future where we focus on repair and restoration rather than simply dulling the nerve signals. Keep an eye on these developments and don't be afraid to ask your specialist if you might be a candidate for regenerative therapies. One final, incredibly important point involves the emotional toll of aging and the tendency for older adults to isolate themselves when they are in pain. Isolation is a health risk in itself. It increases the risk of heart disease, depression, and cognitive decline. When you are struggling with pain, it is easy to stop going out, stop seeing friends, and stop engaging in the activities that bring you joy. This withdrawal only makes the pain seem more prominent and all-consuming. Do your best to stay connected. Engage in social activities that are low impact, like book clubs, community groups, or just regular coffee dates with friends. Laughter, companionship, and social interaction are powerful, scientifically proven tools that lower cortisol, improve heart health, and make chronic pain much more manageable. You are a resilient individual, and you have survived and thrived through decades of life. This challenge is just one more hurdle, and with the right information, the right team, and a commitment to your own well-being, you can overcome it. We also want to briefly touch upon the environmental factors that can influence your health. Sometimes we don't realize that our living space is working against us. Are your shoes supportive, or are they worn out, contributing to foot and back pain? Is your bed comfortable and supportive enough to provide restorative sleep? Is your workspace ergonomically sound? These small physical elements of your environment can be significant contributors to the chronic pain that leads you to reach for a pill in the first place. Small adjustments, like getting a proper pair of orthotic insoles, investing in a supportive mattress, or adjusting the height of your chair, can sometimes provide more relief than a bottle of pills. Never underestimate the impact of your physical environment on your daily pain levels. We also want to remind you that your journey is unique. What works for your neighbor or your friend might not be the right path for you. Your body has its own history, its own genetics, and its own set of challenges. This is why a personalized approach is so vital. When you sit down with your doctor, be prepared to talk about your life, not just your pain. Tell them what you want to be able to do. Do you want to play with your grandchildren? Do you want to take up gardening again? Do you want to walk through the park without discomfort? When your doctor understands your goals, they can tailor their treatment plan to help you achieve them. This transforms the conversation from "how do we stop the pain" to "how do we help you live your best life?" And that is a much more powerful and productive place to be. Furthermore, recognize that there will be good days and bad days. Do not get discouraged if you have a flare-up. Chronic pain management is not a straight line. It is a journey with ups and downs. If you have a bad day, don't view it as a failure of your strategy. View it as a temporary setback and get back on track the next day. The consistency of your habits, the healthy diet, the movement, the sleep, the stress management, is what will build your long-term resilience. Do not let one bad day define your entire health trajectory. Keep the long view in mind, and trust that the small positive changes you are making today are compounding and building a stronger, healthier foundation for your future. It is also important to address the role of family and caregivers. If you are watching this video because you are concerned about a parent or loved one, you have a vital role to play. You are their advocate. Sometimes, as we age, we lose the energy or the confidence to challenge our doctors or to keep track of complex medication schedules. You can be the one to help them organize their pill boxes, check their blood pressure, prepare healthy, anti-inflammatory meals, and help them get to their physical therapy appointments. Your support, encouragement, and active participation in their care can make a life-changing difference. Often, a parent might minimize their pain or hide their medication use because they don't want to be a burden. By opening up the conversation and showing that you care about their quality of life, you give them the permission to be honest about what they are struggling with and to seek help. As we conclude this discussion, let's reiterate the main takeaway. You are the guardian of your own health. The medical system is there to support you, but you are the one living in your body every single day. You are the one who knows how it feels, how it functions, and when something doesn't feel right. Trust your instincts. If a medication makes you feel dizzy, if your feet are swelling, if you are feeling breathless, listen to those signals. They are not random. They are your body communicating with you. Do not let anyone, even a professional, convince you that you should just live with side effects that feel dangerous. You have the right to feel safe, healthy, and vibrant, regardless of your age.